So improving patient experience is a priority for the Global Lung Cancer Coalition, but there was little data comparing patient experience between countries. So what we decided to do was we set out to gain insights globally on patient experience by working with associations and organisations, advocacy groups around the globe, and looking at a few main themes. So there were three main themes: demographics, experiences, and intervention. The demographics were used generally for looking at population by gender, age, and diagnosis. Intervention was to look at testing and treatments people had within the cancer journey, and the experiences side of things was looking at how involved people felt in decision making about their care, importantly whether they felt treated with dignity and respect, and how they described themselves as, for example, patient, survivor, or other. The survey was translated into different languages to enable people to complete the survey in their own language. As it was the first time we had attempted a global patient experience survey, we really didn't know what to expect or what the findings would show. But there were themes that resonated with that of national organisations. From a European aspect, 1 in 10 people felt that they were not always treated with dignity and respect. 1 in 10 people did not know what type of cancer, what type of lung cancer they had. And the survey also showed that there's more that we can do to improve information we give to patients and how we involve them in decision making, as 1 in 5 people, or 19%, felt they were not involved in decisions about their treatment and care. Lung cancer remains a stigmatized condition due to its association with smoking, although we know that there are a proportion of people who develop lung cancer who are non-smokers. This can have a negative psychological impact, as people may be reluctant to seek treatment or receive support. And in fact, it could lead to conditions such as anxiety and depression. As I mentioned earlier, there's some people that do not know what type of lung cancer they have. And you would question, if they didn't know what type of lung cancer they have, then how involved could they feel in decision making about their treatment and care? It was also evident, and this is something that's still experienced, in people being treated with dignity and respect. I think it is essential that we treat people as individuals, and they need to know that the medical team are actually on their side and working with them, for them. So this combination suggests that patients do not have the appropriate level of support in their early stages of the pathway. And I think it's key to say that part of that support mechanism is having access to a lung cancer nurse specialist, which we do have in the UK. We know that receiving a diagnosis of lung cancer can be devastating, so it's crucial that people have a good experience of treatment and care for as long as they can, and to access what they need when they need it. Well, from the survey results, we know that people are willing to engage and share their experiences, so greater involvement of patients and their carers could actually lead to enhanced patient-centred care. Improvements to having access to appropriate information and support in order for people to feel involved about decision making about their treatment and care. And we need to continue working towards removing the stigma attached to a lung cancer diagnosis, as all people deserve to be treated with dignity and respect, especially by their medical teams, and be afforded the highest quality of care. I'd just like to reinforce that we were very grateful and thankful for the respondents of the global survey. In a relatively short timeline, we received 907 responses, so we're very grateful to those respondents and grateful to the Global Lung Cancer Coalition for taking forward such an important piece of foundation work.